interesting questions in the chat room, ladies and gentlemen. You're missing out if you're not there. The drgliddenshow.tv, the drgliddenshow.tv. Let's go back to the phones right now, up to Washington, maybe Washington State, I think. Talk to Patricia. Hey, Patricia, thanks for the phone call. You are live.
Hi, Dr. Glidden. How are you?
Well, I'm good, thanks. What part of Washington are you in?
Yakima.
Oh, yeah, very nice out there.
Yeah.
You guys have some good wine out there, I'll give you that much.
We have some fabulous wine, so come to Yakima and I'll treat you.
I will. I'm there. I love it. I think I've given a couple lectures in Yakima. Did you ever come to one?
Yes, you have. Oh, yeah, both times.
Oh, great. Well, there you go. Appreciate your support. So what's up?
Well, I have two clients with two different questions, and one is relatively easy. I looked through the listing on your website, and I'm not sure I found one. He has ED, and he wants to know about treating ED, or at least taking somebody to help him with his ED. But I don't know if you have one on that already or not.
I can't remember off the top of my head. Yeah, I'm here. I can't remember. I was taking a drink. I can't remember whether I've done a standalone webinar on erectile dysfunction, but I'll tell you off the top of my head what our take on it is. Remember, in the context of longevity, in the context of this radio program, we don't treat disease. So when someone has erectile dysfunction, it would be prudent to give their hormones support. Well, as it turns out, all steroid sex hormones in the human body are made from cholesterol. So, right? So the recommendation is, eat 12 eggs a day. Eat a stick of butter a day. Eat, chicken with the skin. Eat the skin. Throw the chicken away. Eat a diet that's high in cholesterol. Eliminate the 10 bad foods. And take the 90 essential nutrients appropriate for body weight with extra essential fatty acids, right? So I would do the Healthy Body Start Pack 2.0 liquid. I do one of those. I do one bottle of plant-derived minerals and 2 bottles of selenium per 100 pounds of body weight per month. Add to that 1 bottle of multi-EFAs per month and a diet high in cholesterol, and he should be fine, no problemo.
Okay, awesome.
ProstFX, also, by the way, I just want to add, I've had feedback from people in the field that ProstFX is valuable here in order to help male libido, that the ProstFX is not to be overlooked. So to that program for a couple months, I would add 2 bottles of ProstFX per month, 2 bottles of ProstFX per month.
Okay.
Now, we don't want to overlook the obvious, right? But also, especially if this person is elderly, 5 will get you 10 that they're on a cholesterol-lowering statin drug. So they need to have a strong conversation about that because, there's a direct relationship between those two. I mean, that's just common sense. Statin drugs lower cholesterol levels. If you don't have enough cholesterol, you're going to have erectile dysfunction. So there you go.
Yep, I'll be sure to follow with him on that. Okay, another client who's been on the Healthy Start Pack really likes it. She went in to see orthopedic surgeon for her knee. They did a little scope. They said, too late for surgery, blah, blah, blah. So I was talking to her about adding the glucosamine and those products that come in the Healthy Bone and Joint Pack. But she is taking other things, and I just wanted to ask you real quickly about them. One of them is called Injuve, which is a hyaluronic acid. And I've heard this before from others for pain. Do you know anything about that?
I don't. Is that a prescription medication?
No, it is not.
So it's hyaluronic acid. Well, hyaluronic acid is necessary for cartilage formation in the body. So depending on the source and depending on the dose, I think that's an excellent thing to take if you're attempting to support and promote, the structure and function of cartilage in the body. I have no problem with that whatsoever.
Okay. The other one she takes is collagen that has collagen protein, vitamin C, sodium, magnesium, steroid in it.
Well, yeah, so here's the deal with that. I mean, you can go on the Internet, right, and find hundreds of joint support products. You can go to Costco, find 6 or 7 joint support products, right? I mean, everybody and their brother has a joint support product, and, on the one hand, that's a good thing, but on the other hand, my advice based on 25 years of clinical experience and This is the truth. I'm not just saying this to promote longevity. If I have the choice of leaning on Dr. Wallach or leaning on anybody else when it comes to a medical nutrition intervention strategy, I'm going to lean on Dr. Wallach because he literally wrote the book on medical nutrition. So when it comes to, cartilage support, I lean on longevity and Wallach. When it comes to blood sugar support, I lean on longevity and Wallach, even though there are lots of people in the world who sell other products. I'm going to go the Wallach way just because of Dr. Wallach's research and Dr. Wallach's, recipes. As far as I'm concerned, it's really hard to beat that.
Yeah, she had a whole box full of Costco stuff, and we went through it, and I told her things that she could get rid of and things not to buy again.
Well, it's good that people are being proactive, right, and that they're taking active steps to, make things different in their life. But the problem, of course, is that is lack of knowledge, and there's a lot of substandard, inferior, or, unholistic, products on the marketplace. And when you do everything in a holistic fashion, you get such a better response from it. So, proof of the pudding really is in the eating. What I would recommend to her is give the longevity stuff a try for 90 days and then compare the results that she gets. That's really going to be the only way that she or anybody else is going to have any type of a heads up on this.
Okay, I can get her to do that, I'm sure. And I think that's it for today. Thank you,
all right, you're the greatest. Keep up the good work out there, and don't get too sidetracked by those great Yakima wines.
All right,
they're everywhere all the time. I love that part of Washington State. Washington's a real interesting place to be, ladies and gentlemen, because it's almost like a bipolar state. You have the Cascade Mountains running right down the middle of the state. That's the mountain range that Mount St. Helens is in, and Mount Rainier. Don't you think it's ironic that in one of the wettest states in the United States, the biggest mountain is called Rainier? Rainier. R-A-I-N-I-E-R. It's crazy. But that's how it is. And on the east side of the mountains, it's a high desert. Lots of sun, not a lot of rain. On the west side of the mountains, it's rain. Rain, 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 rain. I've said it before, I'll say it again. I think that Starbucks got as big as they did, as fast as they did, because they started in Seattle. And it is so gloomy in Seattle from September until May. I know there are people in longevity who love Seattle. Last time I lived in Seattle, it rained for 93 days in a row. That's why they make caffeine. Let's go from Washington State up north across the border to Canada and talk to Daniel. Hey, Daniel, thanks for the phone call. You are live. Come on in, Daniel. Daniel!
Hello? Hi.
Hey, Daniel, there you are. Thanks for the call, man. What's going on? How can I help?
Well, there is a lady that she's been dealing with itching eyes for many, many years, and now her eyes are very painful. So, she's keep asking me to find out because I don't know how to help her. And
so you want to know what to do to support. Well, one of the most common things that causes eyes to itch on a regular basis is some type of an allergic reaction, right? So and sometimes people just don't know, and one of the most common causes of this is a cat allergy. So does she have cats? Do you know?
I don't know.
So you want to ask her if she has cats, number one. And number two, ask her if she's ever been tested for a cat allergy. Now, if she doesn't have a cat, or, if that's not in play, then we have to consider other allergic things going on in her body. And the best way to kind of intervene there is to support and promote her body's ability to, optimize its immune system function. And we do that with elimination of the 10 bad foods, one Healthy Body Start Pack 2.0 liquid, one Healthy Body Start Pack 2.0 liquid, one bottle of plant-derived minerals, into 2 bottles of selenium, and 1 bottle of Cell Shield RTQ. I'll give you that whole list again. That's 1 Cell Shield RTQ, 2 selenium, 1 plant-derived minerals, and 1 Healthy Body Start Pack 2.0 liquid. That combination of stuff, 1 of those packages per 100 pounds of body weight per month, eliminate the 10 bad foods. And, she's probably having a mild, low-grade allergic reaction to something. If not, then that combination of products should go a long way towards supporting and promoting healthy eyes. Most people with chronic situations like that, which are demonstrable and measurable, and they're just a pain in the neck, they also have all this other stuff that's bothering them that they've just gotten used to and they don't talk about. They've got heartburn every day, or they can't sleep through the night, or they can't fall asleep, or they're woken up in the middle of the night with nightmares, or they've got chronic low-grade anxiety, or something's bugging them, and they've gotten used to it as well. So, this is comprehensive, holistic intervention here, and we want to see something brighten up in a remarkable fashion within the first 90 days.
Awesome. I have a very quick testimony if you want.
Yeah, we've got a minute left, so have at it, brother.
Awesome. This gentleman, he called in urgent to get a pack because he had a schedule to start dialysis, and he didn't want to do that.
Yeah.
And he received a package last Tuesday. I explained them how to take it. Next day before noon, they called me that he was peeing very well all night. And that's the reason why he was going to start. And he canceled it. He postponed it for 1 week, And in less than 24 hours.
So just in 7 days, he was able to have better urinary output with medical nutrition. Just in 7 days. I'm really excited to see what's going to happen 7 months from now. You're awesome, Daniel. Keep up the good work. More to come, folks. Hey. Going to Miami now. Bienvenuto a Miami. Let's go on down south and talk to Abi, one of our favorite longevity people in the world. He can tell us about a testimonial, I think, and also about his radio program for the Spanish-speaking longevity community, En El Mundo. Welcome back, Abi. It's always a pleasure to have you with us.
Thank you. Thank you very much, Dr. Glidden. I want to make sure that you can hear me very well because what I'm going to say is very, very important for people to listen to.
All right. I'm sitting down. I've got my seatbelt fastened and the volume is turned up.
Okay. This weekend I did a test for one of the longest sufferings that I had since I was a child. And I'm gonna be a little dramatic with this because it was a little drama in my life. Since I was 10 years old, I started suffering something, right? And throughout the years, doctors treated me or tried, they could never discover what it was. Never, ever, ever, ever until I was like 23, 24 years old. And it was something as simple as migraine headaches. Now, it was so bad, it got so bad throughout the years that I ended up at the hospital with intravenous pain medication.
Woo.
That was after I graduated from the university in Cuba, right? And I got this one doctor who said, I got to discover what this is because it's getting worse and worse and worse. And they did a million tests for everything, brain tumors, whatever they crossed their minds. And after everything, and months of try to discover what it was, he said, you have nothing, you're perfect, you're fine, I believe you have migraine. And it got so bad that throughout the years that when I got it, so strong that I would lose my vision, my speech, I would get semi-paralyzed, half of my body. I mean, it was really, really bad, really, really bad. I couldn't even touch some substance. And nobody knew what it was. He helped me. He discovered I was having a reaction to yogurt. Something simple as that. That is my favorite drink of everything. I could take a gallon a day. So imagine, since we discovered that, I'm 41 years old right now. I have not been able to take any, not even a tablespoon of yogurt because I will get the migraine, right?
Yeah.
And that is my favorite thing to drink. This weekend I took about 2 liters, and nothing happened ever. Nothing. I had nothing. So I'm so happy. I'm really, really, really happy because now I can take it again. And I am sure it is because of the longevity products.
Well, yeah, I mean, 2 liters, man. You went overboard with it. You really had faith in longevity. But this speaks to the methodology here, right? Because we're not trying to micromanage the body. We're not trying to find out specific biochemical pathways that need to be upregulated or downregulated. All that we're doing is encouraging people to stop eating food that hurts their body and give their bodies nutritional support. And when you give your body nutritional support, the rationale is that the body rallies and fixes itself. Why? Because the body has the built-in God-given ability to fix itself. The body wants to fix itself. The body's trying to fix itself. And in the case of headaches generated, stimulated, antagonized by the consumption of a food, that's a immediate hypersensitivity reaction. It's a food allergy. It's a category of food allergies. And guess what? You can recover from food allergies without allergy shots, which you just did. I put up on the video feed here, Abby, a picture of you, the before and after picture, one of my favorite longevity testimonial pictures of all time. You're doing awesome work down there in Miami. Tell my listening audience, please, about your radio show and how to tune in and turn on.
Yes, you can. People can listen to it in Spanish, and what we're doing is just getting your information and Dr. Wallach's information and your longevity information and putting that up out there in Spanish because people they need to listen to this.
Well, how do they find the radio show? When does it air?
On the same at 7 a.m. Eastern Time every Saturday. It's live, and then after that they can listen to the podcast or download it and send it to their friends and families or.
And what's the website?
Members. Radar90.com.
Radar90.com. Check it out, ladies and gentlemen.
Or they can just go to the GCN Live website and.
So I want to bring Avi back. He hung out over the break, and I just want him to talk a little bit more about the radio program because it is important. Avi, are you still with us?
Yes.
All right, so that's radar90.com, radar90.com, or gcnlive.com. The show airs live Saturday morning, 7 a.m. Is that Eastern Time?
Yes.
All right, fantastic. And how's it going so far?
Oh, it's going very well. Let me tell you, it's. I want to make a call to the people, to the Longevity Nation. Please listen to this. Send it to everybody who speaks Spanish. People need to listen to this. This radio show started as a test. It's going to be a test for a few months. So we need to build an audience. And my wife and I were working really hard, really, really hard. It's hours to prepare one show. Hours. And it's really a sacrifice. People need to listen to this in Spanish. They need to. So I want to make a call to everybody. Just listen to it.
I'm with you 100%. Yeah, Abby. And, this is what we're doing here, right? We're building a grassroots coalition of the informed. And, when shows like yours come along, which fill a void and which create a buzz and which make a difference, then, it's kind of like a wrap, right? It's a good thing. It's only a matter of time, really, until, the station picks you up for more days a week. I don't know whether you want more days a week right now because it is a lot of work and a lot of energy to just generate one show. But tell the listening audience a little bit about your history. You came here from Cuba. How old were you?
I was 28 years old, and at the time I had been suffering for chronic diarrhea for about 8 years since I was about 19, 20 years old. And it got worse, so bad. until when I found longevity, I was going to the restroom like that. I mean, I say that because so people understand what it is. Going to the bathroom 7-8 times a day and in a really bad condition. All that is done. Completely gone. I mean, 100%. It couldn't be any better. And back pain. I have over 20, 30 different issues, and they all disappeared completely. I mean, I think the last one was this one with the yogurt. And maybe it was gone before. I was very afraid to try it because of, it was bad. It was really bad. Every time I got one of those episodes, it was really scary for me.
Yeah, I bet. And also you lost 40 pounds into the bargain, and you've completely transformed your body, completely transformed it 100%.
And I still keep the same weight. I'm the same weight. No struggle.
Yeah, I know. So right around 130, right?
Around, 132, more or less. But I'll tell you this. Now that I can drink the yogurt, it's going to be a struggle for me. It's going to be a struggle to keep that weight, I'm telling you.
Well, we all need our vices just to keep us humble, and, that's okay. That's how the world turns. Avi, you're always an inspiration. That's radar90.com or gcnlive.com, Saturdays, 7 a.m. Eastern Standard Time. Come back anytime, Avi. I appreciate you more than you know. Keep up the good work in Miami. Utah is up next. Let's go talk to our friends in Utah. Let's see what's happening with Lee. Hey, Lee, thanks for the phone call. You are live.
Good afternoon. I have a couple of issues, but one of them is specifically related to, hold on just a second, let me get rid of you on the other web computer.
You're going to have to mute that down, Lee. Mute that out.
I'm just going to get rid of it here. I'm on Fucoiden. Okay. Anyway, I'm sorry.
All right, I tell you what, I'm going to pick up another call. I'm going to keep you online. I'm going to pick up another call. You're going to have to figure out how to get rid of the background noise, and then I'll be right back. Let's go to Georgia and see what Demetrius is up to. Demetrius, did I get the name right? You are live.
You did get it right, Dr. Glidden. I appreciate you taking my call. How are you today?
Well, I'm great, man. God willing, and the creek don't rise, I'll get better. I appreciate the phone call. What's up?
That is awesome. Well, I'm actually calling on behalf of my wife. I called your show probably about a week or so ago. I think you were out. I talked to Mike. He's been really helpful. Just a quick history from my wife. She's been battling cancer since 2007. At the age of 25 is when she was first diagnosed. She's been diagnosed twice since then, in 2010, and then just this past year with metastatic breast cancer. And it's currently in her spinal fluid as well as around her brain. And my main reason now for calling is because Mike had helped us. Mike Phillips had helped us with some products that would definitely help my wife, and we're really excited because we've done a lot of reading and research over these past years since my wife was first diagnosed. And but my question now is, she actually just came from the doctors, and the doctor said that she has her liver is enlarged, and we were wondering, was there anything specific outside of the two healthy body and brain packs that she should be, looking at or starting to try?
Well, I'm assuming that the liver malfunction was caused as a side effect of chemo. Is that correct?
That's what they're thinking. She had just had actual radiation. She didn't have chemo this time, but she had radiation before.
Where there's smoke, there's fire, right? Yeah.
Absolutely, yeah.
Well, okay, so it's a tricky wicket, right? So the thing to understand here about this is that, all things considered, if I had to choose one organ that I wanted to have something the matter with in the human body, it would be the liver.
Okay.
Because the liver is amongst the easiest organs in the body to support and promote the structure and function of, because the liver aggressively, actively, and substantially generates new liver cells all of the time. You can surgically remove over 70% of the liver. Just cut it out, and it'll grow back. I mean, it's remarkable.
Wow. Okay.
It's the only organ in the body that will do that. So it's a relatively, I'm not going to say easy, but it's not a difficult thing to do to support and promote healthy liver function. So selenium, interestingly enough, is of optimal importance here. Selenium is to the liver what calcium is to the bones. Selenium also has been shown to reduce the occurrence of breast cancer by 82%, which is a remarkable thing. So 4 bottles. How much does your wife weigh?
It's about 170 right now.
All right, I would do 4 bottles of selenium a month, 4 bottles of selenium a month, and 2 bottles of immortalium a month. 2 bottles of immortalium a month. And quite frankly, if it were my wife or me, heaven forbid, I would take as much Z-Radical as I could afford. I'd drink a bottle a day of Z-Radical.
Really?
No kidding.
Wow.
I would.
Wow. Now, Let me ask you, so in addition to right now, we're actually waiting on our order of the 2 healthy brain and heart packs. Currently now with all of those products that are in it, so in addition to, you would say 4 for the bottles that you just mentioned and the other 2?
Yeah, so there's in the Healthy Brain and Heart Pack, there's 1 bottle of selenium. If you're getting 2 of those, you're going to have 2 bottles of selenium. So I would order 2 additional bottles of selenium.
Okay.
I would order 2 bottles of immortalium.
Okay.
And as much Z-Radical as you can afford, and I'm not kidding. A bottle a day, a bottle a week, a bottle a month, whatever is in the budget, that's what I would do. And, I have to say this out loud on TV and in the radio here, because it's just a hostile political climate that we're lined up against. Sure. It is illegal for us to treat cancer. We're not saying or even intimating that we're treating cancer. What we are doing, however, is recommending medical nutrition support protocols, the intention of which is to optimize your body's function. That's what I would do if I were her. I would also, of course, eliminate the 10 bad foods and eat a diet high in cholesterol.
Awesome. Okay. Thank you so much, Dr. Brennan.
Yeah, it's my pleasure, man. My heart goes out to you. You stay in touch and let us know what happens as you move down the road. I appreciate your trust very much. Let's go back to Utah and see if our friend Lee has straightened it out. Hey, Lee, thanks for the phone call. You are live. Come on in, Lee. Hello, Lee. Come on in, Lee. Are you there?
I am here.
All right. That's better, Lee. Thanks so much for the patience.
Okay.
That sounds a million times better.
I have a 78-year-old woman who was doing great. She was a very successful realtor and so forth, and she was diagnosed with cancer in a hemorrhoid, of all places. And they operated, removed it, then decided they had to do radiation and then chemotherapy. And since that time, her ears are not just ringing, but screaming.
Yeah.
And she's going crazy.
Yeah. So here's what you can do. Is it both ears or just one?
Both.
All right.
So you want that it was from the chemotherapy.
Yeah, I mean, absolutely, because chemotherapy, by the way, folks, the entire month of October is going to be dedicated towards cancer. We are dedicating the entire month of October on this show to cancer. We're going to talk about different aspects of cancer every week, and we're going to really try to roll it out for people. So, in any event, what I would do here, Lee, is I would get the CM cream, and I would apply it liberally on a Q-tip to the inside of each ear canal. I would apply it liberally on a Q-tip inside of both ears. That may give her short-term symptomatic relief or cut down the intensity of the ringing. That therapy is either going to work or it's not, and you'll know in about 15 minutes. If 15 minutes after putting this stuff in the ear canal, there's no change in the ringing, then you could put a ton of it in and it's not going to make any difference. So you want to give that an experiment. The other thing to do is the Healthy Start Pack, appropriate for body weight, with extra calcium and glucogel, because it's our belief that this is caused by ringing in the ears, is caused by osteoporosis of the skull, which in her case would have been accelerated by the chemotherapy. So the Healthy Start Pack, appropriate for body weight, liquid glucogel plus, appropriate for body weight, and one extra bottle of liquid calcium, my favorite, the Cal Toddy, every month. Do the CM cream inside the ears, keep your fingers crossed, and see what happens. New Jersey's up next, folks. We're finishing out in New Jersey with Nash. Stick around. Well, what can I say? 2 hours again, ladies and gentlemen. Next live event with yours truly tonight for insiders only. It's a live chat, worldwide live chat, 8 o'clock Central Time tonight. Go to drglidden.com for the details. You must be an insider or a guest, an invitee of an insider, in order to gain access to the webinar portal for tonight's live worldwide event, 8 o'clock Central Time. Let's go to Nash in New Jersey and see what's up. Hey, Nash, thanks for the call.
Hi, Dr. Glidden. Thanks for taking my call. I'm 70 years of age. I have multiple problems, but I think most of them are coming from a problem with my kidneys.
Okay.
The EGFR a year ago was 20.
Yeah.
I have no other symptoms other than the EGFR is low.
Yeah.
I have gout episodes, which I'm just getting over 1.
Yeah.
And it's right now it's on the knee, a little bit swelling.
Yeah.
And high BP. BP today was 160 by 88.
Yeah.
Anxiety. And I'm under homeopathic treatment right now. I don't take any allopathic drugs. I don't do that.
So you're not on allopurinol for the gout?
No, I would never take that poison ever.
Okay, good man.
I did have a bypass surgery a couple of years ago, and I took their medicine only for 2 months.
Yeah.
And then I didn't take none of it.
All right. Smart man.
I'm mostly taken homeopathic remedy all my life.
Okay, well, I love homeopathy. My introduction into naturopathic medicine was with the homeopathic treatment, and for the majority of my career, I was that's all that I did was homeopathic intervention.
Right.
And I have to tell you something, Nash. When you apply homeopathy or acupuncture or herbal medicine to a body that's nutrified, you get much better results than if you apply it to a body that's under-nutrified. It's kind of like if you're trying to jumpstart a dead battery in a car. Well, that's a good thing, and that's kind of what homeopathy does. That's what acupuncture does, but the car's got to have gas in the tank, right?
True.
Yeah. So anxiety, we believe, the first thing to think about there is a deficiency in calcium and a deficiency in magnesium. Gout, the persistence of gout is related to a liver dysfunction, and liver needs selenium in addition to some sulfur-bearing nutrients. Those are all easy to get in our armamentarium. And the last thing that you had, so you had the gouty problem. What were the other two things? Why do you think the kidney's involved here? Oh, because of the glomerular filtration rate? Yeah.
It's only 20.
Oh, yeah. Okay. So what you need then is kidney support. And you got to love Dr. Wallach here because, after you do as many autopsies as Dr. Wallach did, you start to get a clue, right? From our point of view, or better said, from Dr. Wallach's point of view, the main reason that kidneys start to become dysfunctional is because they get clogged.
Right.
Now, it's interesting that you had clogged arteries in your heart.
Right.
Because we would argue that the same process is clogging up the micro vessels in and around the kidney. So
yeah, they say, once that is clogged, non-functioning, I don't know what they call ephrons or something like that.
Yeah. Well, I know they tell you that you can't get that back, but we've had lots of people who've been on dialysis and gotten off of dialysis because kidney function bounces back. Sometimes you can, sometimes you can't. You got nothing to lose here, brother.
Right.
So the recommendation, this is important because we believe that inappropriate consumption of food is the main cause of arteries getting clogged anywhere in the body.
Right.
So you have to eliminate the 10 bad foods.
I know that list.
Number 2, I would take 1 Healthy Body Start Pack 2.0 liquid. 1 Healthy Body Start Pack 2.0 liquid, 2 bottles of selenium, 1 bottle of plant-derived minerals per 100 pounds of body weight per month. That's
1 bottle of plant-derived minerals.
Yep, minerals, yep. And on top of that all, 1 bottle of Ultimate Daily Capsules per month. Ultimate Daily Capsules per month. Eliminate the 10 bad foods and watch the webinar that I did on inflammation. Yeah. You need to increase your ORAC consumption to over 100,000 ORAC points a day. You can do it, Nash. I know you can. Ladies and gentlemen, God willing and the creek don't rise. I'll see you tonight and then tomorrow, same bat time, same bat station. Live long and prosper.